So look, I see the numbers on our audience, and frankly, a lot of you guys will know what I'm talking about here. And it's because I seem to appeal to a certain age group. Love it. And in this one, your age happens to have a lot to do with what's happening. And for most of you in my audience, you'll likely receive a specific letter in your mailbox every fall. And in that letter, it has your new Medicare rates. And every year, you open it while saying a little prayer or crossing your fingers or rubbing your lucky crystal necklace while hoping that the number stays the same as last year. But coming this fall, for about 75% of the 25 million people on Medicare Part D, your prayers, your digital flexibility, your lucky quartz gets tossed right in the dumpster along with your hope and maybe your budget. The Wall Street Journal was reporting on Tuesday that the Trump administration is ending the subsidy program that's been keeping Part D premiums lower. After this year, those subsidies stop, and those new rates start in the fall. Ironically, right around the same time that you're supposed to be voting in the midterms. Something to keep in mind. And if you look at the administration's numbers, 25% of the enrollees, they stay flat, no change. That's good. 30%, they see an increase, but it's under $10 a month. Okay? But for 45%, nearly half of everybody on the plan, they see their monthly bill go up between $11 and $20. Now, that doesn't sound like a lot until you remember that the average Part D payment right now is about $36 a month. So a $26 jump or a $20 jump on a $36 bill, that's a sizable increase, especially for people on a fixed income, for people who didn't ask for this. And that's on top of the fact that 700 prescription drugs covered under Part D have already gone up in price under this administration. 700. So this subsidy cut just stacks a second bill on top of the first one. Now, the administration's official excuse is that the subsidies were encouraging insurers to inflate their rates in the first place, and that there are, quote, other affordable options if premiums do rise. Other affordable options. AKA, this administration's entire plan for fixing healthcare is go figure it out yourself. Because you remember, the administration bragged forever that they had a plan. Well, this is the plan. Figure it out yourself. And tell me in the comments if you're on Medicare or if you've got a parent or a partner or a friend who is. It's a small increase, but what is it going to do to your budget? I know it's not much, but what are you going to have to live without now? And remember, this administration's own signature tax bill is projected to cut Medicare funding by roughly $500 billion over the next 8 years. Trump himself said that it's not possible to keep paying for Medicare at current levels, but he can pay for billionaire tax breaks and the war in Iran. Of course, the White House pulled that clip down, scrubbed it, nothing to see here. And they're betting that you forget all of that by November. And it is a bet with real odds behind it because health insurance costs have been climbing faster than paychecks for years now. But now you're adding a rent hike, a grocery bill, a gas tank that never seems to get any cheaper, and you've got a fixed income household absorbing yet another line item increase. And it's timed to a season when nobody's paying close attention to the mailer from their insurance company because their mailbox is full of political ads. 25 million people are on these plans. Remember, to those 25 million, Trump and his regime don't care about you. Remember that.
But it's not possible for us to take care of daycare, Medicaid, Medicare, all these individual things. They can do it on a state basis. You can't do it on a federal. We have to take care of one thing, military protection.
And guys, independent media like us, we survive because you guys show up for it. So do me a favor, take a second, leave a comment, or tell someone that's about to open this envelope this fall what's actually going to be in it. Because that mailer isn't going to explain the $800 billion version of the story. But you can count on us to do it.